Good afternoon, everyone. It's great to see everybody and catch up on Friday afternoon. We had a good meeting recently of our Southern region counterparts, but now it's great to see some additional faces. So we caught up on the people in the waiting room, Sandy? All right.
We're all caught up.
Okay, so if you want to share the PowerPoint, we'll go ahead and get started. So this afternoon, we've got two things that we're gonna try to do. So, which is to hear a report out from our program action team that's focused on health. And then I'm going to continue to share a few of the results from the national survey that we participated in last summer, early fall. And so with that, let's go ahead and advance slide. Let's see, maybe I can do that. Okay, so you're reminded of our First Friday events. So this is one of the things that we bring to you as part of our Extension Committee on Organization and Policy benefits for the system. And these virtual meetings are, the First Friday events are every other month, complemented by alternate monthly meetings where we have more general updates from the chair. All right, next slide. So you're reminded of the way that you can engage. So you can either raise your hand or use the comment features to ask questions, and then we'll have a brief feedback survey at the end of today's meeting. I will tell you that today's meeting, we're going to stop the recording after the health program action team report. The survey results we think are important to have the context with them. So we didn't want either the individual slides or the recording to not to be shared in a way that didn't include that context. And so we'll stop recording, we'll share the slides. And then if you have interest in additional detail about those, the executive directors of your respective regional associations will have access to that. So, I'll also remind you of a couple of upcoming dates if you are an opportunity. So if you're going to be at PILD at the Leadership Development Conference, there'll be an opportunity for extension directors who are there to meet with Bev Durgan and others. I will be there for part of the conference, but there will be an opportunity at 2:00 Eastern at PILD for section members to meet to talk about our capacity funding initiative. And so if you're going to be there for that, again, look for information about that and opportunity to participate with that. So, and hopefully you've got NETA on your schedules in September. I saw NETA in red November, September 16th. So in Louisville is the 16th, the day of travel. The conference is the 17th through 19th. So, all right, I think with that, I'm going to turn it over to Roger Rennekamp and the team from the Center for Community Health and Evaluation to provide us an update on some of the health teams' work.
Well, thanks, Damona. Let's go ahead and switch our slide decks and take the one down. And Kate, if you would bring up the one that we have prepared for the presentation this afternoon. Wonderful, there we go. So, hi, everybody, and thanks for joining us. Again, I'm Roger Rennekamp, Health Director for the Extension Committee on Organization and Policy. And today, you're going to be hearing some of the results from a recent survey of Cooperative Extension's growing health infrastructure at land-grant universities across the country that was conducted by our longtime evaluation partner, the Center for Community Health and Evaluation. And as most of you know, Cooperative Extension's national framework for health equity and well-being serves as our roadmap for becoming a more active and visible partner in improving the nation's health. Through the survey, we wanted to know how we're progressing on that journey, more specifically, how land-grant institutions have grown their capacity to support our expanded role in health over the last 5 years. So why 5 years? Well, it was roughly 5 years ago that the focus of the Robert Wood Johnson Foundation grant to National 4-H Council shifted its focus from direct support to communities toward building our system-wide capacity to work in new and impactful ways. We're proud of the work that was accomplished in those 52 communities supported by the grant, but by encouragement and mutual agreement with our funder, we changed our focus to support system-wide capacity building. We will use the results of the survey to help secure additional funding, focus our professional development offerings, and inform our future work. And before hearing the results, we want to express a big thank you to both the 8 institutions that helped pilot the survey and the 51 institutions that responded to our invitation to participate. The plan for our time today is for Kate Katzman from the Center for Community Health and Evaluation to present the results of the survey, followed by discussion led by Maggie Jones, also of CCHE. We're interested to hear your reactions and questions regarding the information that is shared. And with that, I'm going to hand it over to Kate to lead us through the presentation.
Great. Thank you, Roger. As Roger mentioned, I'm with the Center for Community Health and Evaluation, CCHE, just making sure I can advance. Great. And I'm joined by my colleague, Maggie Jones. We're both based in Seattle, Washington. I wanted to take a moment to just share a little background about our history with Extension. CCHE has been an evaluation and learning partner with Extension since 2019. We worked on the evaluation of the Robert Wood Johnson Foundation Well-Connected Communities Grant, which is wrapping up 6 years of funding over the next year. And CCHE also worked alongside Extension in 2022 to carry out a national resources and readiness assessment related to implementing the framework. And this work was supported by USDA NIFA. Okay, now I'll dive into the survey. Roger mentioned the goal and the purpose of the survey already, so I'll just describe for you briefly the structure and content. We're aiming for annual administration of the survey going forward, and we'll be re-administering it this fall. The survey had 23 questions, 17 quantitative and 6 open-ended, some asking for current status and others about the past 5 years. And I'll talk more about the survey sample on the next slide. The content of the survey focused on these 5 top areas in blue that you see on the slide, and the presentation will present results from the survey in this order. Our team has also prepared a report summarizing the results of the survey that goes into more detail than we'll have time to cover today, and we'll make sure that's shared with you after the presentation. In terms of survey administration, we asked for only 1 survey response per LGU. And I just want to reiterate the thanks that Roger shared. I know some on the call were a part of submitting the survey for your institutions, and just really appreciate the time and the energy that it took to complete these types of responses. We know it usually required engagement with multiple personnel and conversations, and we thank you for that. The survey was sent to all 76 of the 1862 and 1890 institutions, usually the health points of contact for that institution, and we received 51 responses, covering 67% of all institutions. A list of health contacts at 1994 institutions was not available at the time of the survey, was distributed, so they were not asked to complete the survey. As you can see on this slide, the southern region, followed by the north central region, represent the largest proportions of the sample. The 2 extension regions with the most LGUs, the 1890 institutions, followed by the western region, had the lowest response rate, with 8 out of 19 1890 institutions responding, and 10 out of 17 western region LGUs responding. And I just call this out so that when we point out regional variation, you can interpret that with some caution, since not all LGUs from each region were able to respond. Before diving into the results, I just wanted to preview the discussion questions. We'd love to hear from you at the end, if we have a few minutes together that Maggie will lead. Just interested in what this data is telling you about opportunities and challenges, who else you think might need to see this data, how might it help you or this group with making the case to grow health-related programming. And we're also wondering if there are additional developments since the survey launched and health and well-being work that you might have to share. So just to keep those in mind as we go through the presentation today. So here we'll start through some results. At the very start of the survey, we asked LGUs to rate how familiar extension staff at their institution are with the 2021 National Framework for Health Equity and Wellbeing. On the left, you'll see the ratings overall, and on the right by extension region. Overall, 40 out of 51 LGUs, or 78%, indicated their staff are at least somewhat familiar with the framework, with 22% or 11 LGUs reporting no familiarity. Some LGUs from the Northeast, 1890s, and Southern regions reported their staff were very familiar. Oh, I'll just go back to that real quick. I had one more thing to point out, that CCHE asked the same question about framework familiarity of county-based staff as part of a survey in 2022, and familiarity was rated lower, with only about half of respondents saying they were at least somewhat familiar. That's just a note that this rating may depend on the perspective and position of those completing the survey and might not necessarily reflect how county agents are feeling about the framework. Respondents were also asked to rate how much of a priority each of the 5 high-level recommendations from the framework were for their LGU in fall 2023. So next to each recommendation listed on the slide, you'll see the number of LGUs that responded to that question, and this varied somewhat. This is because LGUs could skip questions in the survey or indicate they don't know or are unsure. And the number of don't know, unsure aren't reflected on this slide because they made up a really small number of responses. But for all charts going forward, you'll see the number of LGUs called out on the slide. As you can see from the darker green bars, recommendation 4 on partnerships and recommendation 1 on health equity were rated as a high priority by over half of LGUs that responded to the survey. Recommendation 5 on community coalitions and recommendation 2 on community assessment processes had the highest number of LGUs rating these as an emerging priority or not a priority. Feedback on the results indicated institutions might have had concerns about how they would appear when rating how much of a priority recommendation 1 on health equity is for their institution. And it's also possible that institutions did not consider some recommendations a high priority because they already felt like their capacity or competency or work in those areas was already strong. Okay, now we'll move to recommendation 3. So on the left-hand side of the slide, you'll see the 4 sub-recommendations within recommendation 3 that focuses on investing in the success and visibility of Extension's health-related professionals, programs, and initiatives. And on the previous slide, this recommendation was rated as a priority by 83% of LGUs. This was singled out just to understand in more depth because it's a key lever in supporting implementation of the framework. The question used a 5-part scale to ask LGUs how consistent or how in place their institution's current policies and practices are, ranging from, in dark green, consistently in place, to gray, not in place. Results on this slide tell us that securing funding for health-related work is a little further along than having dedicated staff or practices that incentivize the work focused on health and equity. So I'll wrap up this section on the framework by reiterating a couple of the key takeaways. The survey found that most staff are at least somewhat familiar with the framework. Recommendation 4 on partnerships and recommendation 1 on health equity were rated the highest priority by LGUs. Results focusing on recommendation 3 indicated that securing funding for health-related work may be further along than having dedicated staff or practices that incentivize the work focused on health and equity. And now we'll move to the next section. This part of the survey asked institutions if 17 pre-populated health and well-being topics were a part of the scope of their health and well-being work at their institution. And in order from the top of the slide are the most frequently reported health topics, with at least 80% of LGUs reporting these topics as part of their work. And you'll see the top 5 in the darker blue at the top. As part of the question in this section, respondents were also asked to indicate which extension unit their work on each topic falls under, and they could select more than one unit. For 9 out of 17 of the health topics, LGUs reported that the work falls mostly under their Family and Consumer Sciences unit, and that's among the LGUs that had that unit at their institution. And I'll talk later about cross-program partnership across these same health topics. I want to talk for a moment about SNAP-Ed and FNEP. We know these signature programs are critically important to cooperative extension and contribute significantly to health and well-being programming at institutions. Together, these programs reach more than 2 million individuals and families with nutrition information and catalyze community-based efforts focused on policy, systems, and environmental change. Nearly $300 million each year supports this work, and with it comes diversity to extension staff and participants. In the survey, institutions were asked to exclude SNAP-Ed and FNEP from their responses, given that data is already available through other sources and funding levels are determined externally based on eligible populations. So with this data, we have a better understanding of health and well-being programming and extension that's above and beyond what SNAP-Ed and FNEP currently contribute. So now I'll talk a little bit about funding for health and well-being work. In total, 38 LGUs estimated about $140 million in external grant funding for health and well-being work in 2023. So as I mentioned, this excludes SNAP-Ed and FNEP funding. And this funding amount was very difficult for institutions to provide. 12 were not able to answer this question, and 1 indicated they received 0 funding, primarily focused on health. The distribution of funding amounts that you see was a large range, with the highest number landing in the $1 to $3 million bucket. And LGUs from the southern and western regions contributed the highest amounts of external funding to the overall total. So now we'll look at change into funding for health and well-being work over the last 5 years. The top bar is looking at internal funding, which is any funding within the institution, including internal resource allocation or core funding that supports staff and other costs. The bottom bar is looking at any funding outside the institution, including grants and contracts external to extension. We see in this bar that 41 out of 50 LGUs, or 82%, increased external funding for health in the last 5 years, while only 23 out of 49 LGUs increased internal funding for health. Almost all LGUs that increased internal funding also increased external funding, suggesting that more funding can lead to more funding. There was not a lot of regional variation in responses, except for 2 areas that I point out on this slide. The first is that the western and southern regions had the most LGUs reporting increased internal funding for health in the last 5 years. And the southern region had the highest number of LGUs reporting their external funding significantly increased. And in the survey, we defined significantly increased as more than doubling in the last 5 years. So our team ran some significance tests and found that having a high obesity program, or HOP funding, is associated with increased external funding focused on health in the last 5 years. And this likely includes HOP funding itself. There was no significant relationship for the other national health grants we looked at, including Excite and WCC, or Well-Connected Communities. HOP LGUs are concentrated in the southern region, which may account for some of the regional differences you see on this slide. There were a couple of limitations to our analysis I'd like to point out here. We did not control for the size of the institution, which could be predictive of levels of funding and staffing. And we did not account for differences in federal capacity funds that are received by 1862 and 1890 institutions. And these differences mean 1862 and 1890 institutions don't have the same opportunities to increase health and well-being infrastructure, particularly for funding and staffing. So I'll just wrap up the key points from this section. 38 LGUs estimated about $140 million in external funding for health and well-being work outside of SNAP-Ed and FNEP funding in 2023. Most LGUs increased external funding for health in the past 5 years. And we found that HOP funding was associated with increased external funding focused on health. Now we'll talk about leadership structure that supports health and well-being work at extension institutions. And I should point out, if you are having questions or things popping up, feel free to use the chat. My colleague Maggie is taking a look at that for me. As you see on the slide, the most commonly reported leadership structure by 48% of institutions was that health and well-being work is part of Family and Consumer Sciences program area. And this was followed by having a dedicated unit or center leading the work. And some examples of the names of dedicated units or programs for health and well-being work are on this slide, right? In our analysis, we found that the presence of a dedicated unit or center leading health and well-being work was associated with increased funding for health. And we also asked about change in leadership structure in the past 5 years. Just over half of LGUs indicated their leadership structure had not changed in the last 5 years. But for the 21 LGUs that did report change, they described those changes as adding interdisciplinary outcome teams, merging or creating new program areas, renaming FCS to better align with their work, or adding a state-level position for health. Now we'll talk a little bit about staffing. The survey asked about the current number of dedicated, or those with 100% FTE, health and well-being positions. In keeping with the questions about funding, LGUs were asked to exclude SNAP-Ed and FNEP staff when thinking about their responses. In total, LGUs estimated having about 960 dedicated health and well-being positions, with about half of LGUs indicating those positions make up 1 to 10% of their workforce, so a smaller proportion. Feedback on the results indicated that the 960 number may be a gross underestimate of staff working on health and well-being work, since staff that work partially on SNAP-Ed and FNEP were excluded. Now we'll look at changes to health-related staff in the last 5 years. Looking at the distribution of type of staff engaged in health and well-being work, a little over half of LGUs increased health-related state-level positions and intern and practicum students. LGUs reported the least amount of change in district or regional positions and AmeriCorps positions, as you can see. The gray bars on the right-hand side are where LGUs indicated they didn't have these position types at their institutions. And in comments in the survey, 3 institutions named that funding shortages did not allow them to maintain or add staff in the past 5 years. One thing that was interesting is that LGUs mentioned a couple ways they were able to increase their intern and practicum students. And that was through collaboration on campus MPH programs or with their bachelor's in public health programs. And another way is through federal grants that fund scholarships or internships with extension. So folks are getting a bit creative there too. We'll go on now to looking at equitable hiring practices. So just a little background within recommendation 1 of the framework, which focuses on health equity, there's an emphasis to prioritize hiring, retention, and development of a diverse and culturally sensitive workforce. And these questions aim to understand how much of a priority it is for institutions to have structures and systems that support equitable hiring policies and practices. The scale was a high priority, indicated by the dark green, to a not a priority, seen in the gray bar. And the top 3 practices were rated as a priority by over half of LGUs. The bottom 4 practices had more institutions indicating these practices are emerging as a priority or not yet a priority. And as seen in the small orange bars, some practices are a priority, but local limitations prevent those institutions from acting on them. And a majority of 1890 institutions and North Central region institutions rated all 7 of these practices as a priority. So wrapping up this section on leadership and staffing, I'll share our key points again. We found that health and well-being work was most frequently under the umbrella of the Family and Consumer Sciences program area, and the presence of a dedicated unit or center leading health and well-being work was associated with increased internal funding for health. Health-related state-level staff positions increased the most in the past 5 years. Equitable hiring practices are a current or emerging priority for LGUs. These findings tie back to recommendation 3 of the framework, which support the leadership and staffing for health and well-being work. And it'll be interesting to see if in the next year, when we re-administer the survey, if there's any changes to these again. This will be the last section on results before we pause for discussion. As part of understanding progress, supporting recommendation 5, focused on advancing the work of coalitions, the survey assessed how community coalition and engagement evolved, including the current status and what roles extension staff plays in coalitions. 80% of LGUs reported community coalition engagement increased in the last 5 years. And across all regions, a majority of LGUs reported that their institutions always or often engage with community coalitions focused on health in their work. The roles most frequently indicated were attending coalition meetings, participating in work group or committee meetings, and providing leadership. The survey asked as well how engagement of community partners, youth, and volunteers in Extension's health and well-being work has changed in the last 5 years. 84%, or 41 out of 49 LGUs, increased the number of community partners in the last 5 years, while increases to the number of youth and trained volunteers were less common. Again, institutions were instructed here to exclude SNAP-Ed and FNAP from their responses. In comments in the survey, LGUs offered some perspectives on the trends in volunteer engagement. Some said their increases were due to new grants and a strategic focus on growing volunteer engagement, and others said that decreases during the pandemic of volunteers had still not bounced back. Cross-program partnering within Extension allows LGUs to broaden the understanding and implementation of health and well-being efforts beyond just the purview of family and consumer sciences. So each health and well-being topic that was in the scope of LGU's work, we asked if they could select which Extension units their work fell under, as I talked about earlier. And the topics on the left side of this table were most frequently led by more than one program, and had more than half of LGUs reporting partnering across programs on these topic areas that you see here. And these topics tend to be broader, like food systems work, and areas Extension has been working on the longest, with both state and county level staff engaging in the work. And it's likely that more staff engaged in a topic, that the more staff engaged in the topic, the more capacity there is to partner outside of a single program. The topics on the right were most frequently led by only one program, and usually family and consumer sciences. These topics tended to be more focused on adults and were newer or emerging areas for Extension. Cross-program partnering was common across Extension regions. 3 LGUs even reported working across programs on 16 out of 17 health topics. So wrapping up this section, we learned that LGUs increased the number of community partners for health and well-being work over the last 5 years. Most LGUs increased community coalition engagement and shared they always or often engage with coalitions and health work. Cross-program partnering was common, particularly in the areas Extension has been working a long time and with the most staff. And in the future, we might want to understand a little bit more about partnerships, since this was one of the highest rated priority recommendations that I reported on earlier. So this final slide, we're just going to hit on the key findings I shared with you today, because I know I've been throwing a lot at you. First, most LGUs reported staff are at least somewhat familiar with the framework, and that the recommendations were at least somewhat of a priority for their institutions. LGUs reported that these 5 health topics were most frequently a part of their health and well-being work. The total estimated amount of external funding for health and well-being work was about $140 million in 2023, excluding SNAP-Ed and FNAP funding. And most LGUs increased external funding for health over the last 5 years. Health and well-being work was mostly led by FCS program area. And across institutions, LGUs estimated they have almost 1,000 dedicated staff, or 100% FTE, to health and well-being work. In the past 5 years, the largest increase was to state-level positions. And finally, LGUs increased the number of community partners in the last 5 years, and cross-program partnering was common. So you may be wondering at this point, what happens next? Well, our team, in partnership with Roger and Carrie, will be sharing these results at the National Health Outreach Conference in May, and hopefully we'll get to see some of you all there. We invite this group to take the report of the results and share it at your institutions. There's an appendix to the report that includes a discussion guide to help prompt reflections, ideas, or actions within LGUs as you review the results. So that could be a resource. Also mentioned the Health Leadership Committee, which advises on the overall direction of Extension's health equity and well-being work, reviewed these results in late 2023 and used them to inform its work plan in 2024. That work plan is also found in the report. One thing to point out is that the Health Leadership Committee recommended maintaining a focus on recognizing and rewarding the work of Extension professionals under Recommendation 3 through creation of an updated set of core competencies for health Extension professionals and sharing existing resources on personal performance metrics. So there's more information to come on that work later this year. Two other updates to share. Another group, the Extension Health Metrics Work Group, which consists of Extension professionals working towards identifying system-wide measures that tell the story of Extension's impact on health and well-being work across the country. And part of this work group's efforts are to look for cross-program measures, which are defined as data collected across multiple projects or grants and reported at the unit, state, or regional level. And we added this question to support their work to the survey and found that over half of institutions were interested in starting, expanding, or improving their cross-program measures, showing an interest in growing the system's capacity to measure and report out its health-related work. So this work group will meet again on October 19th to advance this work. And if you're interested, you can let Carrie Gabbard know if you'd like to join in. Lastly, to support Extension's programs in understanding their current capacity to implement health and well-being work internally and with community partners, CCHE is developing an institutional self-assessment. This is a local team-based dialogue tool with questions and offers guidance and a vision on what building capacity at an institutional level might entail. It's self-administered and serves local action planning needs. And more about this will be shared in 2024. Our team is also going to help with re-administering the infrastructure survey again in the fall of 2024. So with that, I'll turn to our discussion. We're interested in hearing more from you and hear those questions again. Thank you.
Thanks, Kate. And if it's too loud in here, maybe you can take over, but hopefully it's okay. I'm not at home today. So we'd love to hear from you all about what this data speaks to in terms of opportunities or challenges for Extension. If you have questions that came up or things that gaps in the information or other things you'd like to know about this, we'd also love to hear that. And we'd love to start thinking about how this information could help you, help this group, help others in Extension make the case to continue to grow health-related programming, and any updates or developments that you have that maybe have happened in the last 6 months or so that aren't accounted for in the survey results. So we'd just love to open it up to questions or comments. You can put things in the chat. I also chatted these discussion questions in, and maybe we can take them, we did this in another group and it worked well to sort of take the questions one at a time. So I'm going to pop the first one in there about what opportunities or challenges, sort of what resonated with you from this data. What does it highlight about the work of Extension right now? So you can put it in chat or would welcome any comments verbally as well.
And I can stop sharing so we can have more of a discussion.
I think for me, it just pointed out the variety of responses. So we all have individual situations. It's clear there's a lot of conversations happening at different levels. So I think, for me, having the materials that we can share out with our family consumer science as well as our health program leaders will be important. I think our our local educators would be interested as well.
Demona, one of the things that I heard, was that you have to invest in order to be able to expand, that there's a lot of resources out there, but if we don't invest internally, we're not gonna have the capacity to have the team to go get those resources, which will benefit us, in the future. And also that there's likely broader groups of individuals. It's not focused on single individual positions, that we're gonna be more successful as teams. And we might be working outside of this sphere of individuals who've gotten together in the past to go after things in sort of the FCS area.
Those are all great points, Vicki, in terms of the connections between the data points. And, while we can't tell the directionality of internal and external funding, it does seem like internal investment helps to create opportunities. I mean, we all know how much it takes to write grants and to seek out those opportunities, and that requires staff time to do that. So it makes sense to me that there's a correlation there. Appreciate your comments. Other thoughts, reflections?
I just wanted to highlight that I think the same thing that Maggie said, highlighting actually how investing in a health and wellness position pays off, how it maximizes the opportunity to bring in additional money that more than pays for the position. But also the comment about family and consumer sciences, and does it still reflect, or does it reflect the health part of what Extension is doing in the public eye? Right now, family and consumer science is the one taking on the majority, if not the totality, of the work that has been done through Extension around health. Doesn't need to be that way, because also, 4-H and Ag should be doing health work as well. So I think that's a question in some states. I mean, I don't know that we have anybody here from Virginia Tech. I mean, there have been changes around names of what we call somebody in the public eye. So I think that's something that gives us ideas. Which,
Really,
let me be redundant, Maggie,
Yeah.
here. It's something that we also need to bring up with USDA NIFA. Because why is it that we're not claiming health at that program level 2, right? They've been a great partner. Some of that money that comes, through CDC and then gets to the Extension Foundation and so forth is part of that. So that I think there's something here to have a larger conversation around.
Yeah, thanks, Corey. I think the cross-program work and that health isn't just family consumer sciences is really important, and part of, what we've been trying to pay attention to is how to unsilo the work when so much of the funding is siloed in terms of how, funding comes down. So appreciate the thoughts about engaging NIFA in these conversations as well. We just have a couple minutes left before we want to turn it back to Demona to talk about the other agenda item. Any final thoughts or comments? All right, well, hearing none, really, did you have something else, Demona, to add? Okay. Well, really appreciate your time and for inviting Kate and I into this space with you today. We will be, as we said in the chat, getting these slides and the report to you, and really would welcome and appreciate you sharing these within your extension programs, and feel free to reach out to either Kate or I if you have questions or need additional information. We really are hoping that this information benefits you all and helps to continue to advance the work. So thanks so much for having us.
Thanks. I think that there are a lot of interesting insights. It'll take me a minute to process them, to read through a bit more and study it. So maybe follow-up questions later. So thank you all for your work there. Good. All right, Sandy, if you'll assist me in part 2 slides. So we're going to shift and kind of quickly